Hi, Pujit. Thank you so much
Hello.
for
Hi.
thank you so much for meeting with me today to discuss mental health. I don't know if would you like to introduce yourself, just a little bit about why you're here
Yeah,
talking to me about.
for people who don't know me, so I'm Pujit Gandhi. I have AMN, and work-wise, I'm a consultant psychiatrist in general adult psychiatry. So work with people what we call the working age adults between the ages of 18 and 65. So I live and work in Scotland in the Kingdom of Fife, County of Fife. So yeah,
Very lovely place
and
to live.
also very importantly, I think I must mention that I'm very interested in complementary therapies, and therefore people, know me from me doing the mindfulness session.
Yes, and you're doing one later on, so we're all looking
Yeah,
forward to that, to chilling out after our day at the conference. So I think, especially due to COVID and the pandemic, we've all become much more aware of mental health, and it's being talked about more. I do just wonder if people really understand sort of mental health has lots of different connotations, etc. So I just thought maybe we should begin with perhaps an explanation from you, Pujit, about what we kind of mean about when we say mental health, and the different aspects of looking up, of what mental health means.
I think it's a splendid starting question. It's something, uh, very important to make this distinction that there are there are different connotations, as you very rightly said. As a psychiatrist, what we tend to deal with is the more severe end of the spectrum and what we would call as mental illnesses or mental disorders. And that's a small proportion of, ge- general population who would experience that. But there's a huge proportion of people who would experience what would be called as mental health problems
Yeah,
or stress, uh, which doesn't meet the threshold for being diagnosed as a illness and requiring treatment. But there are these figures people might have heard that 1 in 3 people have experienced some form of a mental disorder at some point in their life.
yeah,
And it's not mental disorder like diagnosed bipolar or schizophrenia or depression, but a lower level of being stressed, not coping very well. However, what is important is to be aware, to be cognizant of this low level of mental health problems. Because if they go unnoticed, and worse still, if they're noticed but they get, you know, people are in denial,
yeah,
or people think, oh, I don't have time for myself. So if these problems don't go, if you don't do something to address them, then there is a high likelihood these will become more manifest, more formal mental illnesses. So it's very important to nip things in the bud. And for that, everyone, not just people in our leukodystrophy family, patients, carers, but generally everyone in population should be aware of these and do something early on to prevent them from becoming more, bigger of a problem, which
yeah,
then requires specialist intervention.
yeah, absolutely. That's, really good way of explaining it, and sort of kind of categorizing sort of mental illness with sort of mental health problems. Thank you so much for that. Obviously, you mentioned our leukodystrophy family, and we do know that lots of families do struggle with stress and anxiety, feeling very
Mhm.
low, which is completely understandable, especially when you're given a rare disease diagnosis. No one's heard of it. you know, you've never heard of it, you know, and suddenly you've been getting this diagnosis either for yourself or for your child. And we know that this can kind of bring additional challenges because life changes dramatically. People sometimes have to give up work to help care for someone. And we just wondered if you could we could have a conversation about such as helping people to deal with that time when, you know, the loved one is diagnosed, and those feelings of isolation and fear and, you know, all those kind of, which all come together, and can be a really, really difficult time, you know. Just what would you advise? Are there any sort of things that you could suggest are good to sort of try and do?
Again, such an important area. First and foremost, I would say to everyone who is diagnosed and for the near and dear ones, you know, one of the feelings is, an initial feeling at least, is that of unfairness, that life been unjust. Why me?
Absolutely.
It's very important to remind yourself that even though it's a rare disease, there are literally thousands of people with the same diagnosis around the world, you know, even in the very rare diseases. And with ALD, AMN, we know 1 in 15,000. So that's a lot of people around the world. And in some ways, particularly for our group, I personally felt very grateful that at least I got the diagnosis.
Yeah.
Because it took me, and this would be the same story with a lot of people with AMN. It takes a long time, decades, to get the right treatment. And in worst cases, and we know plenty of people from the fraternity that their uncle or dad or somebody perhaps never got the right diagnosis. So in some ways, we should feel grateful that we at least now have identified the problem.
Yeah.
That we can either not do anything about, but that's not the case. There's always something we can do. Just knowledge is power. So just the knowledge that we have a certain illness should empower us. But I know the initial feeling would be like, why did it have to happen to me? Why me? At that time, it's very important. Don't withdraw. Don't become insular. Talk about your feelings. And it's normal. It's very normal. Some of these things, Karen, you described, it's very important for people to bear in mind. That's sort of a normal human response for vast majority of humans. So it's fine to feel that way. It's okay to feel that way. There might be a sense of anger as well, sense of, you know, people can become very low, and it's okay. It's important to accept that these are genuine feelings. This is what's happening in my mind. So first is that.
I think that's a really good point, actually, is that we're all almost fearful of accepting that these feelings are normal. You know, they're kind of to be expected. You know, we kind of feel these feelings, but we still kind of feel like we shouldn't be feeling like this. You know, sometimes people say, oh, there's people much worse off than I am, that kind of thing. But actually, this is about you and your family, and you are going to feel those kind of, you know, very low kind of ebb and low feelings at the time, kind of thing. I mean, of course, this also involves family members and friends, because they can all have similar feelings as well. And we know that often the kind of wider family actually feel a bit helpless because they feel like there's not much that they can do to help the person. That, you know, you have to think about them as well, and kind of thinking about how those support systems work.
So I wanted to actually, that's why your initial previous question, I wanted to break it down into two bits, two groups of people, somewhere maybe three. One is patient who has been diagnosed, the person who has been given the diagnosis. And then there is the unaffected family member.
Yes.
The carer who is going to be the carer. And then there would be one of those carers, and there'll be like plenty of mums whose sons have been diagnosed, and now they have found they are carriers, and we know that AMN carriers, there's nothing as carriers, they will all become symptomatic at some point, will have some degree of mild symptoms.
Yes.
So so I would think of them as three separate ones, and very quickly trying to just think of what the person has got the diagnosis, as I previously said, don't feel life's been unfair. Initially it'll come, be aware of that, accept that, but actually try and challenge that and think, at least I have a diagnosis. This could have gone as undiagnosed or being told you have psychosomatic, it's all in your mind, there's nothing wrong. And there are lots of treatments we know, and this, our weekend would cover, has already covered a lot of things in the past as well. There are treatments, there are things we can do to help improve quality of life.
Yeah.
For the carers, what I would say is, what is very important is don't feel guilty. Initial feeling would be that of guilt, I'm pretty sure.
Yeah, absolutely.
My mom feels that way, and most moms feel, oh, we have given it to our own child, as if you chose to tweak that gene in your body. No, you didn't. It just happened. So challenge that, talk about that, talk to someone. With people, there are lots of people in your similar situation, in the leukodystrophy family.
Yeah.
There's yourself, Karen, and Sarah, and there's so many wonderful people. So reach out to them. Don't bottle it up. Talk about these. And also never feel that you definitely have to do something. Sometimes all you need to do is to tell your loved one that we are there by your side. That's all that's sometimes needed. You do not have to go and start now, rescuing them and thinking, oh, I have to take care of them. No, most of us are, I work full time. I have a lot of issues, mobility issues and all. I've been working from home since the start of the pandemic, but people can still do a lot of things with help. I have power chair, rollator, and aids adjustments. So yeah.
So if you, I suppose I'm sort of saying, what would you recommend? So if someone found themselves that they really were on this kind of downward spiral, and really were feeling kind of that they were withdrawing, and life was just sort of becoming so difficult to cope with, which it can be very overwhelming, especially for parents where their child is diagnosed and they're sadly deteriorating. And I suppose, as a mum myself, you just keep going. You keep going because you feel like you have to. And it almost feels like some kind of form of weakness if you kind of put your hand up and say, actually, I'm really struggling here, What would you say to someone if they, if a friend came to you, or if I came to you and said, I'm really struggling, I'm feeling really overwhelmed. Kind of what would your sort of advice be?
I have a bit of a formula in my mind, which I repeat with a lot of my patients in my clinics and their carers. And I think that's very applicable to everyone.
Yeah.
I think we can generalize it to everyone. And again, I would think of the two groups, carers and affected people,
Yeah.
and the third group, which is, when you are both, you're caring as well and you have some symptoms. First, the generic things, which I think everyone should, basic principles of good mental hygiene. And I think if people Googled it, they'll find these similar things. Basic things. First, good diet.
Yeah.
Seems very simple. Good, healthy, balanced diet. And when we are stressed, this suffers. I'm not saying don't eat, don't have takeaways, no. But by and large, try and make sure you are getting the proper enough nutrients, enough protein, enough vitamins, minerals, because our brain, literally the brain requires neurotransmitters, and all these transmitters people would have heard, serotonin, dopamine, noradrenaline, whatnot. They require, the building blocks are what we eat. So make sure you are taking a good diet. 2, very simple. There's a chronic, big, not chronic, but a huge growing problem of lack of sleep around the world.
Yes.
We are not sleeping enough. We are spending far too much time on devices which emit certain light. Close, the mobile phones, they emit certain light which suppress the hormone melatonin, which is the signal for darkness and makes us sleep.
Yes.
So on average, humans are sleeping a lot less, and we have this artificial sun. I mean, the electricity powered.
Yeah.
We have lights. So very careful that try and get adequate amount of sleep, at least bare minimum of 6 hours, ideally a bit more, at the time when humans are meant to sleep. Huge therapeutic benefit of that. And the productivity is much higher the following day. So good diet, adequate sleep, a bit of exercise, a spot of exercise. And Department of Health has given certain dosage of exercise as well, depending on if you do light or moderate or high intensity. So if you do vigorous exercise, 75 minutes per week, spread over 3-4 days, not every day. And doesn't involve going to the gym or getting any fancy equipment, just running, doing push-ups, any form of exercise, swimming, going on a hikes. And I know that people like me just can't do that with AMN. But even, we can, a bit of yoga, a bit of stretching, doing some things, even sitting on the wheelchair. You can do things. There was a session organized by Alex TLC, chair yoga.
Yes.
There are things which can be done. And if you do moderate activity, it's 150 minutes per week. So a bit of exercise. Now, I'm going to say something which people won't like. My patients don't like to hear that. Try and not use illicit drugs and alcohol. And I know it's very much in the culture. In this country, you socialize, you drink, but don't use it as a coping mechanism. That shouldn't be that. I've had a very stressful day caring for my whoever, and I'm just going to relax with a glass of wine. There are healthier ways of doing that. Alcohol is a well-known depressant. It depresses the central nervous system, depresses the anxieties, depresses the memories, depresses the reflexes, depresses the mood as well. But only temporarily, it depresses the anxieties. There are fine healthier means. And then the next thing would be, diet, exercise, sleep, your avoiding drugs and alcohol, and generally managing stress. And how do you manage stress? Is first and foremost, recognize it. Admit. A lot of people live in denial and they're like, I don't have the time. I just need to go on, as you were saying, Karen. we'll keep going, I'll keep plodding on until we collapse, then you're no good to anyone. You're no good to yourself and your. So it's very important to look after yourself. And that thing they say in flights, pre-flight announcement, first put the mask on yourself, then help the other one, even if it's your baby. So looking after yourself, you are doing a huge favor to the rest of your family. So recognize, admit there is some problem. If it's not huge, talk to friends, talk to you, Karen.
Yes.
Go. And if things are like really, it seems things are something more is needed, then there are, approach your GP. There are organizations, Samaritans. In Scotland, at least, we have this breathing space. And you can find them locally. You'll find the resources where you can. There are text messaging services nowadays. I think it's called Give Me a Shout. So phone, online, or text. Reach out. Don't bottle it. I think they are the main ones.
Yeah, definitely important to actually kind of not scared to say, actually, things are getting difficult for me.
That reminds me, I forgot very important one though. When you use the word say, humans are social animals. And why we have succeeded as a species is because we communicate. And when we are stressed, then we can become, withdrawn.
Yeah.
Research has shown that people who socialize, I think it is 10 minutes every day, reach out to their friends and family, and it need not be in person, even electronically, tend to have better mental illness, better mental well-being, and better memory. So this research was also done, so having a good old blether, the Scottish word, but just gossiping about nothing big, intellectual. Don't try and solve the climate problem of the world. Just gossiping has been found to be very therapeutic. Basically, making connection with other human beings is very important. And if your time, your health allows, trying to do small bits of charity towards others. When I say charity, I mean just tiny acts of kindness, help. You don't have to go and start volunteering, but small bits. Doing something for others is again something that's really good for own mental well-being.
Yeah. And that could even be, it's sort of, we often put families together who are, are at very similar stages in their lives and dealing with very similar situations. So that can be really supportive as well, can't it? For everyone's mental well-being and just that real support of not feeling completely alone, sort of thing. So mindfulness.
Mindfulness, one of my favorite things. Yeah. I mean, huge amount of research now, but the first thing I tell is this mindfulness, as we know, was, it's thousands of years old. And the Gautam Buddha formalized it and sort of manualized it 2,600 years ago. If something has gone on for that length of time, it must be doing something.
Yeah.
And now research shows that it's great for anxiety. This Professor John Kabat-Zinn in Harvard in early 1970s, he did a lot of research in this mindfulness-based stress reduction. It's been shown to help chronic pain. It's been helped to help. It's not, I'm not saying it's a be-all and end-all kind of treatment, but it can really help anxiety situations, chronic depression, recurrent depression. So it's, the formal practice can be really effective, but at least informal practice of just being mindful when you are, say, eating, or like one example I've given in the past is, like when you're brushing your teeth, just being immersed in it, as in being aware of where my hand is, what's happening on my sensation on my teeth. So being mindful of all your actions throughout the day. That's the informal practice of mindfulness, but also the formal practice of just sitting down for 15 minutes a day, put a guided track on, freely available on YouTube.
Yeah.
So that can be very effective.
Yeah. And I think it's definitely, just even taking that 10 minutes out, we've all got very busy lives, and, we're caring, we're trying to work, we've still got all the usual stuff we have to do. But actually having just that 10 minutes, when I've been in your sessions before, Pujit, and you said about, when you're brushing your teeth, and, and I make sure I do that, I kind of, I stop thinking about what I've got to do for the rest of the day, and it might only be 3 minutes, at that given time, but it's still just kind of it just calms the mind, doesn't it? It just sort of gives you that tiny bit of breathing space. That,
It sort of resets it. It's very much. Suddenly, I've come up with this analogy. If the phone is working very slow, there are lots of apps going. So that's all the different worries. Sometimes restarting your laptop or your phone. So think of this time as you're investing in yourself and improving the productivity later.
Yeah. No, that's been so helpful. Thank you, Pujit. And yeah, I'm certainly, I said earlier, looking forward to your mindfulness session, and I hope lots of people will join us. I think the sort of takeaways for me is definitely, make sure that you talk about how you're feeling, that with a friend.
You're not alone, and there is help available.
Yeah. And whether that's with a family member or a friend, or if you go to someone, more formal, such as GP, if things are feeling really overwhelming, then, you really should try and seek help, because you can get better. There is help out there.
Yeah.
So thank you so much. And we shall see you later.
It's lovely talking to you, and good luck, everyone.
Thank you, Pujit. Bye for now.
Bye-bye.